Alright, welcome to the video on the heart. We're going to start with my favorite quote on the heart. The heart has 4 delicate valves that control the direction of blood flow. They open and close more than 100,000 times a day, 36 million times a year. Unless altered by disease, they are able to withstand this stress almost indefinitely. No man-made material can be flexed so frequently and so long without breaking. Each day, the adult heart pumps enough fluid to fill a 2,000-gallon tank. The work it performs daily is equivalent to lifting a 150-pound man to the top of the Empire State Building, consuming only about 4 watts of energy, less than that used by a small light bulb in your home. At the crest of the heart is a source of electricity that transmits energy down special lines, causing myriads of muscle fibers to work together. That's by Russell M. Nelson, a world-famous heart surgeon and current prophet and president of the Church of Jesus Christ of Latter-day Saints. So hearts are amazing. Heart valves, we've tried to make artificial heart valves and they wear out. So we have to transplant valves, or sometimes they transplant valves from pigs, but we can't make good heart valves. And then the amount of work they do with so small amount of energy, there's nothing we can make that is anywhere near that efficient. Alright, so let's talk about the heart. It is located in the mediastinum. It is about the size of your fist. It's located in the mediastinum in the center of your chest, and it does lean towards the left. And its function is to pump blood. And so it's going to circulate that blood throughout the body, and then that the blood transports things all throughout your body. This figure shows the chambers and the valves. So on top you have a right and left atrium, or atria is plural. The atria act as blood reservoirs, so as blood is returning to the heart, it fills up in the atria. And then they do contract to push their blood into the ventricles, but the ventricles act as the pumps. The atria don't have to generate much force, so if your atria are... A lot of people, their atria don't work, and it's not a problem. You survive just fine with that. But the ventricles, you can see they're much thicker because they have to generate a lot of force. They have to pump the blood throughout the whole body. So if you have a problem with your ventricle, you're in trouble. So atria are reservoirs, ventricles are pumps. Alright, if we look at these valves from the top view, on the left we see when the ventricles are relaxed, the tricuspid and mitral valves, those are known as the AV valves, are open, and then the aortic and pulmonary valves, those are known as the semilunar valves, those are closed. When the ventricles contract, that closes the tricuspid and mitral valve and opens the pulmonary and aortic valves. So the valves make sure that the blood flows one way and that it doesn't leak backwards, and that makes the heart much more efficient. And these valves are going to open and close in response to pressure changes. So when the ventricles are relaxed, there's low pressure. That's why the tricuspid and mitral valves are open. When the ventricles contract, the pressure increases. That causes the tricuspid and mitral valves to close and the pulmonary and aortic valves to open. This shows the heart skeleton and how the heart muscles work together as a pump. This shows the heart valves. This is where you would, or the heart sounds, where you would put a stethoscope to listen to the different heart sounds. And your doctor might hear a weird sound called a heart murmur, and that happens when blood is flowing backwards through a valve. So if the valves were to become damaged, they don't close completely. That can cause a heart murmur, and that makes your heart not work as efficiently, and that's not good for you. Alright, next we're going to talk about blood flow through the heart. So we're going to start with blood coming into the right atrium. It's going to start there, and then it is going to flow through the tricuspid valve into the right ventricle. Then from the right ventricle, when it contracts, it's going to open the pulmonary valve, and then that blood is going to flow into the pulmonary artery, and to the right and left pulmonary arteries, and to the lungs. And there it will pick up oxygen and get rid of carbon dioxide. Then is going to come back to the heart through the pulmonary veins, and it's going to come to the left atrium. From the left atrium, it's going to go through the mitral valve and into the left ventricle. Then when the left ventricle contracts, that's going to open the aortic valve, and it's going to flow through the aortic valve and into the aorta, and then from there out to the rest of the body. So that's the flow of blood through the heart. Next is angina and myocardial infarction. So these are caused by blood flow to the heart being blocked due to blocked or narrowed arteries. A lot of times this is due to cholesterol building up in them. This causes pain and it can cause cell death. So angina is temporary. It might be due to you have a blood vessel that's partially blocked, and it's okay normally, but when you're exercising, then it's not enough blood supply, and that causes pain. But if the blood flow returns to normal, there's no cell death and you're fine. But that could be a warning sign. MI is short for myocardial infarction, or that's a heart attack. That's a complete block of blood, and that causes cell death, and that's not good. Depending on how much of the heart dies, you may or may not be okay. Next thing is collateral circulation. So if a coronary artery gradually narrows, new blood vessels can develop around the blockage, and that way that the blood can go through. Regular exercise promotes the development of greater collateral circulation, so that's another way that exercise makes your heart healthier. Next we're going to look at the cardiac conduction system. So let's watch this animation.
Cardiac muscle is unique in that it does not depend on stimulation by extrinsic nerves to contract. Instead, it contains pacemaker cells that allow it to contract spontaneously, an ability called automaticity. The electrical impulses generated by the heart follow a very specific route through the myocardium. Normal cardiac impulses arise in the sinoatrial, or SA, node, which is located in the wall of the right atrium, just below the opening of the superior vena cava. From there, an interatrial bundle of conducting fibers rapidly conducts the impulses to the left atrium, and both atria begin to contract. The impulse travels along three internodal bundles to the atrioventricular, or AV node. There, it slows considerably to allow the atria time to contract completely, and the ventricles to fill with blood. After passing through the AV node, the impulse picks up speed. It then travels down the bundle of His, also called the atrioventricular, or AV bundle. The AV bundle soon branches into right and left bundle branches. Purkinje fibers conduct the impulses throughout the muscle of both ventricles, causing them to contract almost simultaneously.
Okay, so we need to know the function of the conduction system of the heart. So number one, there's an SA node, that is the pacemaker. That's what starts out this, it's an action potential, spreads throughout the heart, but it starts there in the SA node, and they automatically generate it because of some cool ion channels that they have. Number two, there's the interatrial bundle. It conducts the impulses throughout both atria. Then number three is the AV node. Sorry, three is the internodal bundles, which transmits the impulse down to the AV node. Then at the AV node there's a brief pause, and that allows the atria to finish their contraction before the ventricles contract. That way the ventricles are totally full of blood. Then number four is the bundle of His, or the AV bundle. So from the AV node it passes down the AV bundle, and then to the right and left bundle branches. That's number five. And then number six are the Purkinje fibers, and they spread the electrical signal throughout the ventricles, and this causes the ventricles to contract at the same time. It also makes it so their contraction starts at the bottom, or the apex of the heart, and goes towards the top, and that allows them to squeeze all the blood out of the ventricle. That way the ventricles are working efficiently. Alright, so we mentioned the SA node is our pacemaker. When it fails to fire, there are other pacemaker cells in the AV node or the Purkinje fibers that can start the action potential, but they're going to go at a slow rate. The SA node normally fires around 60 to 80 beats per minute. The AV node is normally around 40 to 60, and the Purkinje fibers would be 20 to 40 beats per minute. Alright, next we have an electrocardiogram. So this is a measurement of the electrical activity of the heart. And if we're measuring the electrical activity, we're assuming the mechanical activity follows. So the action potential causes the heart muscle to contract. So what we're measuring is the action potentials in the heart. First thing we need to know is the P wave, which is in purple here. It represents atrial depolarization, so that's the action potential traveling through the atria. Then the PR interval, that is the time it takes for this cardiac impulse or action potential to travel from the atria to the ventricles. Then the QRS complex, that represents ventricular depolarization, so that's the action potential traveling through the ventricles. Then the ST segment represents the end of ventricular depolarization and the beginning of ventricular repolarization. And this takes longer than a normal action potential. Cardiac action potentials take longer, and that allows the heart to have a chance to fill up with blood. Then the T wave represents ventricular repolarization, so that's the ions in the heart, they're getting back to normal, and it gets ready for the next action potential to come for the next heartbeat. Alright, next thing is the cardiac cycle. So this is the series of events from the beginning of one heartbeat to the beginning of the next. It consists of systole or contraction and diastole or relaxation. And we're going to start with an animation.
The series of events that occur from the beginning of one heartbeat to the beginning of the next is called the cardiac cycle. Here's what happens during one cardiac cycle. In the first step of the cardiac cycle, venous blood returns to the heart and fills the atria. As it does, pressure in the atria rises above that in the ventricles. This causes the atrioventricular valves to open and blood flows into the ventricles. This period is called passive ventricular filling. Atrial systole then occurs. In this phase, the atria contract to eject their remaining volume of blood to the relaxed ventricles. At this point, the atrioventricular valves are open and the semilunar valves are closed. Following is isovolumetric contraction, a brief period during which the ventricles are beginning to contract, but the semilunar valves haven't yet opened. The volume of blood in the ventricles remains constant, but the pressure rises rapidly as the ventricles begin to contract. When the pressure in the ventricles exceeds the pressure in the pulmonary artery and aorta, the semilunar valves open and the phase of ventricular ejection begins. The blood spurts out of each ventricle, rapidly at first and then more slowly as the pressure drops. The ventricles don't eject all of their blood. The blood remaining in the ventricles at the end of the ejection period is the residual volume. At the end of ventricular ejection, a brief period occurs during which both the atrioventricular and semilunar valves are closed. Specifically, the semilunar valves have closed to prevent blood from re-entering the ventricles, but the atrioventricular valves have not yet opened. In this phase, called isovolumetric ventricular relaxation, the volume of blood in the ventricles remains unchanged, but the pressure declines dramatically as the ventricles relax.
Alright, so let's look at each phase one at a time. So phase one is passive ventricular filling. So returning blood fills the atria and pressure in the atria increases. Once the pressure in the atria is greater than the pressure in the ventricles, those atrioventricular valves are going to open and blood flows into the ventricles. And the P wave appears on the electrocardiogram, marking the end of atrial depolarization. Next phase is atrial systole. The atrioventricular valves are open, the semilunar valves are closed, the atria contract, ejecting any remaining blood. The ventricles are relaxed and they fill up. Then phase 3 is called isovolumetric contraction. This is when the ventricles begin to contract. That causes the semilunar valves to, well, the semilunar valves are still closed. The pressure increases and that closes the atrioventricular valves. So during this phase, the pressure increases rapidly because the volume is decreasing. This is when the R wave appears on the EKG or ECG and the first heart sound can be heard. Then phase 4 is ventricular ejection. So once the pressure in the ventricles is greater than the pressure in the aorta and the pulmonary artery, those semilunar valves open and then blood leaves the ventricles. Some blood stays in the residual volume. And this is when you would have the T wave. And then we have isovolumetric ventricular relaxation. So while all 4 valves are closed, the ventricle relaxes, the pressure in the ventricles drops, the T wave ends, and this is when you hear the second heart sound. So those heart sounds are due to the valves closing. And that is the cardiac cycle. So then we have a question, what is the heart's primary pacemaker? And the answer is the SA node, sinoatrial node. Alright, next we need to know what cardiac output is. So cardiac output is the amount of blood pumped by the heart in 1 minute. It's equal to the heart rate, which is the number of times your heart beats in 1 minute, times the stroke volume, which is the amount of blood pumped with each heartbeat. Some factors that affect it, factors like exercise and stress, they're going to stimulate the acceleratory center, which is in the medulla. That activates the sympathetic nervous system, and that's going to increase the heart rate. Things like a rise in blood pressure would stimulate the inhibitory center, again that's in the medulla. That would activate the parasympathetic nervous system, and that's going to cause the heart rate to slow down. Emotions can affect the heart rate as well. Emotions like anxiety, fear, and anger cause the heart rate to beat faster. So if you're constantly in anxiety and fear, you're going to have a fast heartbeat, and it's going to make your heart wear out faster. Grief slows the heart rate. Alright, so another question, cardiac output equals, and the correct answer is heart rate times stroke volume. Alright, congestive heart failure is when either ventricle fails to pump blood effectively. So this figure shows left ventricular failure. This would cause blood to back up in the lungs because the right ventricle is working, so that pumps blood to the lungs, but then when it comes back to the left side, it can't pump it out to the body. So blood backs up in the lungs. This leads to shortness of breath, pulmonary edema or swelling, and coughing. These people, when they're breathing, you can hear it sounds like there's water in their lungs because there is. Right ventricular failure causes blood to back up in the vena cava and veins. This causes swelling throughout the body, enlargement of the liver and spleen, and pooling of fluid in the abdomen. So if either one of those happens, that's congestive heart failure, and it's not good. So exercise and take care of your heart.